We serve everybody that comes through the door, regardless of race, religion, ethnicity, ability to pay, sexual preference, immigration status. We serve everyone. I knew we needed an in-house pharmacy, but I didn't know how we were going to make it work. We were trying to make working with outside pharmacies work, and it was not going well. We couldn't really access the 340B government program in the same way that we wanted to on behalf of our patients, but also pharmacies were leaving this area. In fact, last year in 2024, 20 more pharmacies left. And so access was just almost non-existent. We knew we had to do something, but we also knew we needed help.
When I tell you this pharmacy has made all the difference in being able to care for our patients. I actually had a patient a couple weeks ago who hugged me, and his wife was crying because we were able to get him on the blood thinner that he needed to be on, that he could otherwise afford. And Megan was able to get him on the right medication for a cheap price, and they were just, overjoyed.
At the end of the day, I just want people to take their medications. And so if that means that I need to jump through a couple hoops to make sure that we get them the right medication, I'm more than happy to do that.
Prior to this, there were so many situations where, we'd have patients who would have frequent emergency room visits or just uncontrollable chronic illnesses that just were not really truly being addressed. And then, you'd come to find out, well, it's because we've not been able to get our medication from the pharmacy. Like right now, we're a one-stop shop. They can leave here with their medication at the end of their appointment every single time.
Working with Alchemy has really been good for us. We couldn't have done this. The applications for things, it would have taken us twice as long to figure out exactly what was being asked for. The supply and the access and the requirements, that has been significant. We couldn't have done it without Alchemy. To have Megan as our first pharmacist has been huge because she has a heart for this work. She knows our population, and she just is passionate and organized and thoughtful, and she's really part of our team. So we're just thankful it was Megan.
It's nice to have a moment to celebrate, and for me it's been very heads down work. It has provided an opportunity for me to look up from my computer, from my desk, and reflect on all of the good that we have done and all the good that we will continue to do. And I am so incredibly proud of this pharmacy.